Welcome back. And on the news, it says sad how three Abuja residents died at home due to COVID-19 lockdown. Decomposed body of a lawyer discovered 3 days after her death. Kuba General Hospital rejects cops over fear of coronavirus. The effect of the COVID-19 lockdown has started hitting hard on Nigerians as three residents in Kubwa died at home while observing the lockdown order. The most pathetic is that of a promising female lawyer name withheld from Abia State who resides in the popular millionaires' quarters in Kubwa that was found dead after her body had decomposed. According to the account narrated by the newsguru.com TNG, by her church member, the lawyer had in a chat told a neighbor that she was not feeling too healthy. The neighbor opposite her apartment simply advised her to visit the hospital, but due to the lockdown last Saturday, it was believed she couldn't risk it. By Sunday, her neighbor discovered that her door had remained closed and a stench was emitting from her room. He immediately suspected something was amiss and he alerted the landlord. The matter was reported at Kuba police station after her decomposed body was taken to the Kuba General Hospital. But getting to the hospital, her body was rejected and the landlord and her church member was advised to move her corpse to Gwagwalada Specialist Hospital. My problem with this is that the landlord and the church member should not be responsible for carrying her corpse to wherever. It's not their jobs. But it seems that this is what it is. At Gwagwalada Specialist, the corpse was deposited at the morgue and the hospital authorities said an autopsy cannot be conducted because of the COVID-19 pandemic. The chamber where she practices law was contacted and they in turn contacted her family in Abia State. The other two cases are that of two middle-aged men who slumped and died in Kubwa and their corpses were rejected at Kubwa General Hospital over the same excuse that since there was a pandemic, corpses from the homes cannot be accepted. The families of the deceased were referred to at Gwagwalada Specialist Hospital. Wow. It shows how obviously the health system in Nigeria is worse than other first world countries, but then Nigeria would suffer even more because in other first world countries, if you aren't able to go to the hospital, there's a line that is 24 hours and it is ready to be picked up by actual specialists and they will tell you what to do, or sometimes they can mail the medicine to your house instead of you coming to the hospital. So with a failed system that hasn't put things in place like a 24-hour helpline where she could have called and she could have explained to a doctor, okay, this is what is happening to me, and they could give her remedies or tell her what to do. And obviously she wasn't able to do that because she chose not to go to the hospital because of the COVID-19 lockdown. She didn't want to go against the rules. Someone says this is a serious case that the government needs to look into quickly. Someone says the name of the hospital is the University of Abuja Teaching Hospital, not Gwagwalada Specialist Hospital. Upgraded since 2006. That's 14 years now. So actually, the name of the hospital is the University of Abuja Teaching Hospital. Another person says, we in Nigeria, we are bad. How can you say knowing your neighbor without knowing your neighbor because there is no love? Nobody cares about his neighbor, only ourselves, and that is our weakness. Well, at the end of the day, it's more like Nigerians are just in a situation where with the culture and everything, no one really trusts anybody, and with mysterious ways of how people die, you give good news and then something bad happens. Everyone is on edge, so you can't really blame people for not trusting each other, but we can blame the government for not putting systems in place that would cater to people who are sick at home. That's where we can also place the blame. Someone says, I think we have most educated illiterates in our country. How you know that you're not feeling fine and you're giving excuses with lockdown is a pity. At the end of the day, she could be exposing herself to coronavirus at a hospital if she left the house. And two, the hospitals are already pressurized. They don't want to add more patients to what they already have. So it is a lot. Someone says depression, and hunger, plus frustration of sitting at home and lockdown results, Nigeria is not equipped to lockdown and keep, that is true, Nigeria is not equipped for lockdown and keep people indoors for not providing any food for their citizens, unlike European citizens and other advanced countries. That is very true. You're not even allowed to go to supermarkets. You have to, if you're a compromised citizen, as in like you are the elderly or you have a disability, you're prioritized for home delivery. So like let's say fruits, eggs, whatever, those kind of products, they bring it to your house. But if you're able to walk, you're only, if you're like capable of going shopping, there's a queue. And even in the supermarkets, they label places and they designate places and they say this is the 6 meter mark, 2 meter mark that you have to do to, like, follow social distancing. Someone says, very terrible. May God help all of us. Someone says, this, our government is so wicked. They are not thinking the result of this lockdown could be in their home because they could not stock food with government money. Security are guiding them 24/7. They don't care about others. And that is very true because, especially for the fact that the landlord and the church member had to move her dead body, that alone says a lot because they shouldn't be in charge of a dead body. Like, that shouldn't work. And what if, again, if they're scared that the body has the coronavirus, then what of the landlord and the church member? They should already have it by now. So yeah, they really need to do investigations to see how she died. And obviously it's a lot of situations that they have to take into consideration, but it is very, very sad, and everyone needs to keep positive. Whatever you believe in, God, whatever, just try to make sure that your mental sanity and your just mentally you're okay. Just, you need to take care of that because people are going through it, being alone, not doing anything, and then old habits, bad habits come back, as in like going to smoking, drinking, everything comes back, and then people face so many different things. So the main thing now is just to keep our minds safe. What do you guys think? Are you feeling bad for this? What do you feel the government could have done to prevent this deaths from happening during the lockdown? Put what you think in the comment section below. Do not forget to like and subscribe.